And presenting on behalf of the Kidney Health team is Manuel Escoto, a kidney transplant recipient and a patient, family, and donor partnerships and education manager with the Canadian Donation and Transplantation Research Program. Manuel is involved as a patient partner with the Kidney Foundation, with the CanSolve CKD network, and in the Living Well with Kidney Disease study at the University of Alberta. Sherry Vera is a patient and family advisor with the hospitalist section of the Medicine SCN and has a background in healthcare improvement and quality and continues to seek out opportunities to share her patient partner perspective to improve patient outcomes and increase meaningful patient management. And Sabia Zaman, whose interests are in patient-oriented research, healthcare system innovation, and technology. She received her certificate in patient-oriented research from ABSPOR and is a community advisory committee member in Living Well with Kidney Disease study at the University of Alberta. Sabia is also interested in projects looking at improving the overall well-being of patients and healthcare providers. So I want to again welcome and thank you to the PaCER team for joining us today.
Awesome, Flavia. Thank you for the introduction and for inviting us today to present at this patient forum. Really, what we're doing here today is exploring the impact of dialysis on mental health and wellness on patients with CKD. So just a little bit of background, and as Flavia mentioned, we graduated from the PaCER program in 2020, and really the impact of the PaCER program is that it trains patients like myself, like my colleagues, and very well many of our patients on the call today to be qualitative health researchers. Now, as patients, this is really significant because the overarching goal is to transform the role of patients in healthcare by conducting patient-oriented research by patients, with patients, and for patients. So now, PaCER is an innovative research style in which participants and researchers are peers. Throughout the research process, participants are at the core and guide our PaCER's set, collect, and reflect methodology, which I'll show in a minute. Now, throughout these three integrated research stages, we've utilized an iterative process to learn and understand the patient experience. So what we do by doing this is we uncover common themes through a mixture of focus groups, narrative interviews, and then we bring them back to our research participants, back directly to the patients for validation, for more in-depth exploration, and for understanding. And here's a quick look at the process, at the PaCER process. Now, we undertook this study because as we've talked about, and as many of you know, anywhere between 20 and 40% of dialysis patients experience mental health concerns while receiving this life-saving treatment. Now, the percentage differs depending on the specific case study you might be reading or the diagnosis methodology, but what's clear is that the proportion of individuals experiencing mental health that the number of individuals experience mental health challenges due to the physical demands and many other demands placed by dialysis leads to depression, anxiety, and other mental health concerns. But of course, that depression and anxiety are the most common, illustrated by the literature. So now what's really concerning about this is that currently in Alberta, there's about 450,000 Albertans diagnosed with kidney disease, with hundreds transitioning to dialysis every year. And currently, there's very limited resources available specific for dialysis patients. So as researchers, we are really interested in knowing how dialysis impacts mental wellness and how individuals navigate the stressors associated with treatment. Now, the main objective of our work was to understand the patient experience in their own direct words. A quick outline on our patient population. So patients were eligible to participate in the study if they lived and received treatment in Alberta and had lived experience with dialysis. So in total, we recruited 11 individuals, and all these individuals had experience with either in-center dialysis, peritoneal dialysis, home hemodialysis, or were now transplant recipients. During the SET focus group, we asked participants to talk about their mental health and overall wellness. Now, our patient partners overwhelmingly stated that this was in fact an area of concern and really validated many of the topics and themes that we found in our literature review. Now, participants also helped us narrow our research question, which was, how has CKD and dialysis impacted your mental health? This question really set the stage for Collect, where we dug deeper into the patient partners' perspectives and their lived experiences. So overall, our results can be categorized in two distinct but very much connected categories. The first is our experiential factors impacting mental health and wellness, and then the other was patient coping strategies to overcome these challenges. So now 4 major subcategories emerge from the experiential factors, as you see on the slide. Overall, these 4 categories really highlight some of the perceived gaps in care as identified by our patient partners. And as I go through the next few slides, you'll note that the quotes on the slide come directly from our patient partners. So the first subcategory speaks to perceived lack of recognition by a patient's health team that chronic kidney disease and dialysis does in fact have a real and significant impact on a patient's mental health and wellness. So the transition from CKD to kidney failure requiring dialysis is difficult. Patients' lives change, and there's a loss of normalcy that they experience. Our patient partners express the decline in their quality of life, loss of identity, and an inability to engage in their daily activities. As one participant stated, it's like being taken out at the knees. Another expressed that starting dialysis was like hitting rock bottom. Now, these life changes impacts a patient's mental health and contributes to depression, anxiety, grief, hopelessness, and PTSD. Our patient partners also stated that in Alberta, the kidney care continuum has limited resources available to support mental health and wellness, to increase resilience, and to provide strong coping strategies. The second category is a perceived gaps in system navigation and communication issues within Alberta's kidney care programs. Our patient partners described a significant learning curve with respect to understanding kidney disease, transitioning to dialysis, and then hopefully transplantation. Participants discussed that not having access to consistent and relevant information often led to anxiety and stress. Specifically, one of the themes that kept coming up was that patients receive different advice from different professionals regarding diets, medications, treatment modalities, and this only served to increase their stress levels, especially for new patients. Participants viewed a lack of access to relevant information and a defined process, including information transitioning from CKD to dialysis to transplantation, as a strong contributor to the mistrust within the health system and their health teams. The third subcategory speaks to the lack of support available to patient support networks. Now, our patient participants acknowledge that their diagnosis also affects their family and friends, and they express guilt resulting from the stress and limitations imposed on them and their social networks due to their health status. This impact on support networks still remains largely unrecognized by health professionals. Participants express that there's currently no psychosocial supports offered to families and support systems. In addition, support systems are not trained or provided adequate support on living and caring for dialysis patients. Now, what this ultimately means and leads to is a cycle where patients feel like they need to fake it. And what this means is that patients often tend to minimize their conditions. They might retreat internally rather than having those open and honest conversations with their loved ones. Now, the discrepancy in how they feel physically and mentally and how they present themselves adds to the anguish of them not being authentic to the closest ones. Over time, this cycle can have a negative effect on the relationships. And then the final subcategory of our experiential factors speaks to perceived lack of empathy and invalidation of the patient's healthcare team. Patient partners express that their healthcare providers primarily focus on the physical markers, the biomarkers, the numbers, the metrics of kidney disease as a tool to evaluate their health. This perceived failure to address the person over the disease leads to increased feelings of stress, anxiety, and amplifies that loss of identity that I mentioned earlier. The expectation expressed by some that the healthcare providers feel that a patient undergoing a certain health intervention should feel a better way. So, for example, you should feel better, or they should be experiencing or not experiencing certain symptoms. For example, you shouldn't be cramping. Invalidates the patient's experience and expertise in their own bodies. Patients express that there is a need for a holistic approach to disease management, and that includes a patient's voice, so hidden illnesses such as mental health and wellness also receive appropriate and timely care. With that, I'll pass it over to Sherry, who will discuss patient-identified coping strategies. Thanks.
Thanks, Manuel. Our patient partners experienced a disproportionate burden to become the drivers of their own healthcare needs. There were many reasons for this, but our patient partners believed that it was beneficial for the patient to become a strong self-advocate to ensure that they got the best outcomes and had the best life they could while on dialysis. Our patient partners believed that without the ability to advocate for oneself and develop personalized coping strategies, their mental well-being and the mental well-being of their support networks would suffer. Our patient partners communicated their frustration over the perceived lack of focus on mental well-being from their healthcare teams. This was an unfortunate reality, considering the rich base of evidence that points to the increased risk of mental health concerns within this patient population. Becoming self-advocates, being in the driver's seat of their own care, and developing their own unique coping strategies were all ways that the patient's own actions could positively impact their mental wellness. Next slide. Our patient partners understand that every patient's experience with CKD and dialysis is highly variable, individualized, and complex. They all agreed that they coped better and had better mental health through their treatment because they developed the ability to advocate for themselves. Self-advocacy started with learning all they could about their disease and the various treatment options they had. Our patient partners had a great deal of knowledge about their own disease, new treatments, drug therapies, and the current research and supports available outside of the healthcare system. They kept detailed records of their own individual health journeys, and as a result, they were able to share with their healthcare teams in the event that there were gaps in communication to ensure that they received safe, quality care. Being able to speak to their healthcare teams based on their own knowledge and personal experience gives the patient a sense of control in the face of a disease that takes control away from patients in so many ways. Helping patients to feel confident to advocate for themselves is an essential part of maintaining mental wellness. Our patient partners stress the importance of becoming self-advocates as the best way to navigate a complex health system. Being able to take an active role in following up on appointments or gaining access to additional support from the healthcare system was important and helped the patient to ensure that they did not fall through the cracks. Self-advocacy was also viewed as being vital for anyone seeking to navigate the process of becoming a transplant recipient. Self-advocacy is seen to be the best way to ensure patients maintain their physical and mental wellness. Our patient partners shared many ways that they found not to let dialysis run their lives. They believe strongly in the adage, dialyze to live, don't just live to dialyze. These individual coping strategies were key to maintaining a good quality of life while on dialysis. Journaling, getting into nature, meditation, maintaining hobbies, and staying connected to the people and things that brought them joy before dialysis were all shared as examples of successful coping strategies. Patient partners also shared the importance of sharing their lifestyle goals with their healthcare team and support system so that treatment regimes and lifestyle goals can be factored into the choices of treatment modalities and schedules. Setting goals and expectations for how patients will maintain their connection to their life before dialysis is an important piece for helping patients to maintain a sense of control, purpose, and identity, which can be lost for some as they begin dialysis. Our patient partners had several recommendations that they felt could improve the quality of life for other patients living with CKD on dialysis. These recommendations were divided into two categories. Number one, action patients could take to better self-manage their treatment and engage with the healthcare system. And number two was actions the healthcare system may want to consider addressing to improve the experiences of patients with CKD on dialysis. Here are the patient actions that were identified as key to improving the mental wellness of patients with CKD on dialysis. Support patients to become the advocates to drive their own care. Our patient partners were all strong self-advocates but they acknowledged that this is not the case for many patients in the system. Helping a patient develop strong self-advocacy was key to improving mental wellness. If a patient is unable to take on self-advocacy, it was important to identify a support team member who could take on this role. Peer-to-peer mentoring, our patient partners all agreed that peer-to-peer interactions, like those offered by the Kidney Association, were important to improving mental wellness. Patients will benefit from learning from others with lived experience like theirs and realize that they are not alone in their experiences and struggles. Peer-to-peer interactions create opportunities for real connection with others who are going through the same thing, creating more opportunities for patients to connect with each other, to share their stories, will have benefits to the mental wellness of patients, as well as improve self-advocacy skills and system navigation education. Providing training in health system navigation and seeking opportunities for patient partnerships with healthcare providers in research projects and initiatives. Including patients in the development and delivery of healthcare system navigation training would be beneficial to new patients and allow for the knowledge and perspectives of patients with lived experience to share their journey. This has benefits to both the healthcare system and the patients and will lead to better outcomes and patient experiences. And last, they recommended that all patients set actionable goals for themselves and that patients get mentored in the practice of SMART goal setting. Patient partners believed that it was essential to include the patient in setting goals for their healthcare journey while on dialysis. When patients set goals for themselves, they take ownership of what they can do to achieve those goals and will maintain a more positive outlook. And now I turn it over to our team member, Sabia.
Thanks, Sherry. So as the health system is the domain in which patient care takes place, there were several recommendations on this front from our participants. So these would be actions that can be undertaken by the healthcare system. Our participants would like the dialysis units to adequately resource a peer mentoring program for their patients. They found that sometimes this did occur organically or through a third party such as the Kidney Foundation, and it had positive impacts on their mental wellness. This recommendation was more about being purposeful in establishing the peer mentoring network and to have a buy-in from the staff, essentially formalizing this process. The other aspect that was brought was that the psychosocial supports that are currently available to patients are general, and none of them are specific to CKD and dialysis, which brings its own set of unique challenges. So leveraging existing supports into this practice area, as well as looking into potential ways to increase the scope of practice for social workers who are trained in counseling and system navigation, essentially going beyond the basic financial tax information could provide lasting benefits to CKD patients. The initial experience of receiving diagnosis and starting dialysis can bring about trauma, confusion, and immense loss, especially if the patient has had a crash start. So spending some additional time at the beginning of the patient's journey and at regular intervals throughout to outline the care pathway through resources could help alleviate some of the negative emotions attached to CKD and dialysis. This approach has worked well in cancer care and can be used as a model for the CKD and dialysis patients. Another aspect that impacted mental wellness was the fact that transplantation as a potential option was either discussed later in a patient's journey or sometimes not at all. The participants went through the motion of feelings of not being sick enough and then being too sick for the transplant discussion. And this was a major source of frustration. So starting this conversation early in their journey could help better prepare patients for the possibility of transplantation, while also helping them develop an understanding of the nuances of the transplant journey. A better synergy and collaboration between the dialysis and transplant unit can help with this. Our participants would like to see physicians more visible in the kidney community at events such as the Kidney Foundation Gala and others, and connect with them as partners in care. Our patient partners agreed that the acute clinical care that they received had been outstanding. One room with improvement was regarding asking questions about the whole patient. A paradigm shift from what, like looking at lab values and clinically relevant signs and symptoms, to how, essentially asking the question, how are you doing? And this was not about asking or expecting nephrologists or dialysis nurses or allied health professionals to become psychologists or psychiatrists. It was more about asking questions that appeal to their emotional and cognitive self, in addition to the physical self. So looking at the whole well-being of a patient rather than just looking at numbers. Our partners also suggested offering a basic mental wellness assessment as part of the overall patient assessment during the treatment initiation would be beneficial. These assessments could also be offered at different points throughout the care journey to see if there are additional supports that may be required before the spiraling effect. Next slide, please. So dialysis is a double-edged sword. While it is a life-sustaining treatment, it is also an isolating and burden-filled experience that is associated with many negative health outcomes. Our study found that there are challenges and gaps in the system for supporting mental wellness. And the biggest gap was the perceived lack of psychosocial support for CKD and dialysis patients and their family members. Next slide. Many of our participants found that self-advocacy helped them feel in control and be an active participant of not only their health journey, but also be a patient voice and make meaningful contributions to others in their position. As patients continue to live longer with end-stage renal disease, a pathway to improve access to psychosocial support and patient-centered care for dialysis patients is necessary. This will be a wholesome approach and lead to a better quality of life for these patients and their family members. Next slide. We would like to acknowledge the contributions of Dr. Abir Abutaha, who was a valuable member of the team until she passed away in December 2019, and also acknowledge Alberta Kidney Health Strategic Clinical Network for their support and sponsorship, the Kidney Foundation of Canada and the Northern Alberta